Learning outcomes. Dear students, in the last module, we studied about psychiatric disorders. After studying this module, you shall be able to know what does the term schizophrenia actually mean? What are the signs and symptoms of schizophrenia? What are the causes of this disorder? What are the different types of schizophrenia? And also about the effects and diagnosis of schizophrenia. First, we shall start with the introduction to schizophrenia. Schizophrenia can be described as a condition of brain that disturbs the manner an individual acts, thinks and sees the world. It is frequently categorized by unusual societal behavior and could not identify what is genuine. Common indications comprise of wrong beliefs, auditory hallucinations, disorganized or vague thinking, and idleness and abridged social engagement and emotional expression. Schizophrenia is a challenging disorder that makes it difficult to distinguish between what is real and unreal, think clearly, manage emotions, relate to others, and function normally. The cases of this psychiatric disorder come in sight in the late teenagers or adulthood, though schizophrenia can be observed for the first time in middle age or even later. In extraordinary cases, though the indications are different, it may affect adults and young children. In overall, the earlier the growth of this mental disorder, the more severe it is. Schizophrenia also is likely to be more severe in men as compared to women. Inheritances, early environment, mental and social progressions appear to be significant contributory factors. Analysis is grounded on detected behavior and the individual's described experiences. Next is the history of schizophrenia. The term schizophrenia, which known roughly as splitting of the mind and derived from the Greek roots scizin, meaning to split, and phren, meaning mind, was made by Eugen Bleuler in 1908 and was desired to explain the split up of function between character, thinking, memory and observation. The past of schizophrenia is intricate and does not impart itself easily to a linear description. Cases of a schizophrenia-like syndrome are considered to be infrequent in historical records before the 19th century, although reports of illogical, incomprehensible and uncontrolled behavior were common. A detailed case report in 1797 regarding James Tilly Matthews and accounts by Philippi Pinel published in 1809 are generally marked as the earliest cases of the illness in the medical and psychiatric literature. Now we shall go with the signs and symptoms of schizophrenia. Schizophrenia is frequently explained in respect of positive and negative or deficit symptoms. Positive symptoms are those that most persons do not generally face but are there with the people with schizophrenia. On the other hand, negative symptoms are deficits of common emotional reactions or of other believed procedures and respond less well to medicine. There are 5 kinds of symptoms characteristic of schizophrenia. First are delusions, hallucinations, disorganized speech, disorganized behavior and the so-called negative symptoms. Though the signs and symptoms of schizophrenia differ theatrically from individual to individual, both in form and severity. Not each individual with schizophrenia will have each and every symptom, and the indications of schizophrenia may also change with the time. First, we shall discuss about delusions. A delusion is firmly held idea that a person has, despite clear and obvious evidence that it isn't true. Delusions are enormously common in schizophrenia. taking place in more than 90% of those who have this disorder. Frequently, these delusions involve the irrational or inexplicable thoughts or imaginations. Most schizophrenic delusions comprise delusions of perception, belief that others, often and unclear they, are out to get him or her. These persecutory delusions generally contain inexplicable thoughts and plans. Example, Martians are trying to poison me with radioactive particles delivered through my tap water. Delusions of reference. An impartial environmental incident as supposed to have a special and personal meaning. For example, an individual with schizophrenia might have confidence that a person is a billboard or on the TV is sending a message formed particularly for them. Next is delusions of grandeur. Consider that one is a well-known or significant figure, such as Jesus Christ or Napoleon. Alternately, delusions of grandeur may involve the belief that one has unusual powers that no one else has. Example, the ability to fly. Next is delusions of control. Belief that one's feelings or movements are being controlled by outer, strange forces. Common delusions of control comprise assumed broadcasting. My private thoughts are being transmitted to others. Thought insertion. Someone is planting thoughts in my head. And thought withdrawal. Someone is robbing me of my thoughts. Next is hallucinations. Hallucinations are echoes or other sensations felt as real when considered real only in the individual's mind, while hallucinations can involve any of the five senses. Auditory hallucinations are most common in schizophrenia. Visual hallucinations are also comparatively common. Research proposes that auditory hallucinations occur when people misunderstand their own inner self-talk as coming from an outside source. Schizophrenic hallucinations are generally significant to the individual undergoing them. Many times, the vocal sounds are those of someone they are already familiar with. Mostly, the voices are critical, vulgar, or abusive. Hallucinations are also inclined to be worse when the person is alone. Next is disorganized speech. Split thinking is a feature of schizophrenia. Externally, it can be seen in the way an individual speaks. It may vary from loss of train of belief to sentences only loosely linked in meaning to speech that is not logical, known as word salad in severe cases. They may respond to queries with an unrelated answer, start sentences with one topic and end somewhere completely different, speak incoherently, or say illogical things. Common signs of disorganized speech in schizophrenia include loose associations, quickly fluctuating from topic to topic with no association between one thought and the next. Next is neologisms, made up words or phrases that only have meaning to the patient. Next is perseveration, repetition of words and statements. Next is clang, senseless use of rhyming words. Next symptom is disorganized behavior. Schizophrenia disrupts goal-directed action, creating damages in an individual's capability to take care of him or herself, work and interact with others. Unsystematic behavior observed as a drop in overall everyday functioning, unpredictable or incorrect emotional reactions, actions that look bizarre and have no purpose, lack of inhibition and impulse control. Next are negative symptoms. The so-called negative indications of schizophrenia refer to the non-existence of normal behaviors seen in healthy persons. Common negative signs of schizophrenia comprise lack of emotional expression, emotionless face comprising a flat vocal sound, absence of eye contact and blank or restricted facial expressions, lack of interest or enthusiasm, difficulties with motivation, absence of self-care, seeming lack of interest in the world, superficial ignorance of the environment, communal withdrawal, speech difficulties and abnormalities, incapability to make out a discussion, short and sometimes separated responses to questions, speaking in a monotone. Now we shall discuss about the causes of schizophrenia. The causes of schizophrenia are not fully known. However, a combination of genetic and environmental factors play a role in the growth of schizophrenia. People with a family history of schizophrenia who have a temporary psychosis have a 20 to 40-degree chance of being detected after 1 year. First, we shall discuss about genetic causes. Schizophrenia has a major genetic factor. The highest risk for developing schizophrenia is bearing a first-degree relation with the disease. Risk is 6.5%. More than 40% of monozygotic twins of those with schizophrenia are also affected. If one parent is affected, the risk is about 13%, and if both are affected, the risk is nearly 50%. Next is environmental causes. Environmental factors related with the progress of schizophrenia comprise the living environment, drug use, and prenatal stresses. Childhood trauma, split up from one's families, and being frightened or ill-treated increases the risk of neurosis. Other aspects that play a significant part consist of communal segregation and migration associated to social difficulty, racial discernment, family dysfunction, unemployment, and poor housing conditions. Twin and adoption readings recommended that inherited genes can form an individual susceptible to schizophrenia, and then environmental issues act on this susceptibility to trigger the disorder. Substance use. About 50% of those with schizophrenia use drugs or alcohol excessively. Amphetamine, cocaine, and to a slighter degree, alcohol can outcome in psychosis that offers very correspondingly to schizophrenia. Although it is not normally assumed to be a cause of the disease, studies showed that individuals with schizophrenia use nicotine at much superior rates than the general population. Next is abnormal brain structure. With abnormal brain chemistry, abnormalities in brain configuration may also play a part in schizophrenia. Enlarged brain ventricles are observed in some schizophrenics, representing a deficit in the size of the brain tissue. Now we shall discuss about the types of schizophrenia. Diverse subtypes of schizophrenia are well defined according to the most substantial and predominant features present in each person at each point in time. The result is that one person may be diagnosed with different subtypes over the course of his illness. First is paranoid schizophrenia. The significant feature of the paranoid schizophrenia is the existence of auditory hallucinations or conspicuous delusional judgments about persecution or conspiracy. Paranoid schizophrenia is the very common subtype. The hallucinations and delusions turn around some specific theme, and this theme usually is impartially constant over time, and individuals' personalities and overall behaviors often are connected to the content of the disruption of belief. There is a wide-ranging variety to the nature and severity of the indications that may be found. When signs are in a segment of exacerbation or worsening, there may be some disorder of the thinking procedures. At this time, individuals may have more anxiety than usual, memorizing fresh events, talking logically, or normally acting in an ordered or a balanced way. Next is disorganized schizophrenia. As the name suggests, This subtype's vital characteristic is the disorder of the perception procedures. As a rule, hallucinations and delusions are less noticeable, though there may be some indication of these symptoms. There is impairment in the emotional processes of the individual. These individuals may have noteworthy injuries in their capability to sustain the activities of daily living. Even the more routine tasks like dressing, bathing, or brushing teeth can be considerably weakened or lost. Person identified with this subtype also may have major deficiency in their capability to interact efficiently. At times, their speech will become almost inconceivable due to disorganized thinking. Next is catatonic schizophrenia. The prominent features seen in the catatonic subtype involve movement disturbances. Affected individuals may display a dramatic decrease in movement to the direct that deliberate movement ends, as in catatonic stupor. Alternatively, activity can intensely increase, a stage called as catatonic excitement. Patients may show a resistance to any attempt to change their position. They may keep a halt in which someone asks them, sometimes for long durations. This indication sometimes is known as vexy flexibility. Next is undifferentiated schizophrenia. The undifferentiated subtype is analyzed when individuals have symptoms of schizophrenia that are not appropriately formed or precise enough to allow classification of the illness into one of the other subtypes. The symptoms of any one individual can vary at various points in time, resultant in uncertainty as to the right subtype classification. Next is residual schizophrenia. This subtype is identified when the patient no longer shows noticeable symptoms. In such cases, the schizophrenic symptoms usually have reduced in severity. Hallucinations, delusions, or idiosyncratic behaviors may still be present, but their signs are significantly diminished in contrast to the acute phase of the illness. Next is effects of schizophrenia. When the signs and symptoms of schizophrenia are overlooked or inappropriately cured, the effects can be overwhelming both to the individual with the disorder and those around him or her. Some of the likely effects of schizophrenia are relationship problems. Relationships suffer due to individuals with schizophrenia mostly withdraw and separate themselves. Paranoia can also cause a person with schizophrenia to disbelieve friends and family. Next is disruption to normal daily activities. A schizophrenic individual's delusions, hallucinations, and disordered beliefs usually prevent him or her from doing ordinary things like bathing, eating, etc. Next is alcohol and drug abuse. People with schizophrenia frequently develop problems with alcohol or drugs, which are often used in an attempt to self-medicate or relieve symptoms. Increased suicide risk. People with schizophrenia have a great risk of attempting suicide. Persons with schizophrenia are especially expected to commit suicide during psychotic incidents in the phases of their depression. We shall study about the diagnosis of schizophrenia. An analysis of schizophrenia is done on the basis of a full psychiatric evaluation, medical history, physical exam coupled with the laboratory tests. First, psychiatric evaluation. The psychiatrist will inquire a number of questions to the patient about himself and his loved ones, signs, psychiatric history, and family history of mental health problems. Next is medical history and exam. Your psychiatrist will ask the patient about personal and family health history. He or she will also perform a complete physical examination to check for medical issues that could be causing or contributing to the problem. Next is laboratory tests. While there are no laboratory tests that can analyze schizophrenia, preliminary blood and urine tests can be done for other medical causes or symptoms. The doctor may also ask for brain imaging studies like MRI or a CT scan to find out if any brain abnormalities are related with schizophrenia. We shall conclude this module with the summary. Schizophrenia is a condition of brain that disturbs the manner an individual acts, thinks and sees the world. It is frequently categorized by abnormal social behavior and failure to identify what is genuine. The term schizophrenia was created by Eugen Bleuler in 1908 and was proposed to define the separation of function between personality, thinking, memory and perception. There are 5 types of symptoms characteristic of schizophrenia: delusions, hallucinations, disorganized speech, disorganized behavior and the so-called negative symptoms. The cause of schizophrenia are not fully known. However, a combination of genetic and environmental factors play a role in the development of schizophrenia. Schizophrenia can broadly be classified into 5 different subtypes, that is paranoid, disorganized, catatonic, undifferentiated and residual. If the signs and symptoms of schizophrenia are ignored or not properly treated, the effects can be devastating both to the person having this disorder and also to the individuals who are around the person having this disorder. An analysis of schizophrenia is made grounded on a full psychiatric assessment, medical history, physical examination combined with the laboratory tests. Thank you.